The COVID pandemic was traumatic to the healthcare community and our patients. Providers were excited to have a weapon to combat the COVID-19 virus once the vaccine was approved. I was one of those providers relieved to have a vaccine, as on a daily basis I would tally the deaths in our community from COVID-19 by looking at the discharges from the hospital in our EMR. It was sobering and sad. The isolation of our elderly community and the lack of socialization of our school-aged children was showing its effects on my patients. I had an elderly woman in her 90s who lived in a group home, and the family was only able to visit through the window. She became increasingly depressed and showed up for a visit to discuss her depression once we were seeing patients in the office. They allowed her daughter to transport her to and from the appointment, so I started to schedule the patient's appointments every 2 weeks, even though she really didn't need to be seen that often, just so that she could see her daughter. As patients came in for their regular visits, I was anxious to tell them about the new vaccine, understanding some may be skeptical with it being approved so quickly, and realizing some of their information was coming from unreliable sources. My conversations led to confrontations. I tried to be empathetic and understand where they were coming from, but oftentimes it led to an angry patient, and I was befuddled. Take, for example, Amy, who had a history of recurrent small bowel obstructions. We did a video visit or two in the beginning of the pandemic where she expressed her disbelief of the panic and cautiousness of the medical community, telling me COVID was not a big deal. She told me the number of deaths was being inflated and nobody should be wearing masks. Of course, I tried to challenge her on some of her thoughts, which only led to more anger on her part. She then had worsening abdominal pain one day, presented to the emergency room where she refused to wear a mask, was found to have a small bowel obstruction, and admission to the hospital was recommended, but she refused. She didn't want to do a COVID test, she didn't want to wear a mask, and she didn't want to hear anything more about COVID. Thankfully, she did get better. I had another patient, Brandon, who was in his 50s and was very healthy. He and his whole family of 6 were quite vocal at appointments about not wanting the COVID-19 vaccine because of the bad things they'd heard about it. Brandon got COVID in 2021 with subsequent hypoxia, requiring hospitalization and ICU stay. He thankfully did not require intubation, but was discharged to home on oxygen, which was able to be tapered, but he had fatigue and cough for many months. Despite this, he continued to refuse the COVID vaccine. I had a healthy husband and wife, also in their early 50s, whom I saw for their routine wellness checks and physicals and counseled them on getting the COVID vaccine. The husband was quite argumentative at his visit, but I tried to counsel him with facts, and within a month, they both left my practice. I was seeing Evan, a 7-year-old with severe autism, for a routine child check, and as I had been doing, I recommended an updated flu and COVID vaccine, and the mother started screaming. She was screaming at me that I needed to stop talking because I didn't know what I was talking about. Evan started to cry. I was upset. Mom took him by the hand and left the office, never to return. Why did the patients feel this way when we were on a trajectory to lose greater than 1 million lives due to this horrible virus? With these earlier experiences, I started to recognize which patients were more skeptical and started to tailor my COVID-19 vaccine talk differently. I began to ask, have you had COVID yet? Do you have an elderly family member you are around? I started to tell patients they should consider getting vaccinated to protect their elderly family members. I began talking to patients more about long COVID, as this was something more likely to affect them or a family member or friend. Studies have shown most Americans encounter healthcare misinformation in the media or online. Most adults are uncertain whether health information items are true or false that they see online. According to KFF, the independent source for health policy research, polling, and news, in August of 2023, 10% of adults believed it was true that the COVID-19 vaccine caused sudden death in otherwise healthy people, while about 23% felt it was probably true. My practice of medicine post-COVID-19 is different than before. I used my education, my expertise, my empathy, and up-to-date information on COVID-19. I realized with the vast amount of misinformation, I had to not just take care of my patient's health, as I had before the pandemic, but also assess the receptiveness to information regarding the COVID-19 vaccine and customize my discussion to best make that patient continue to trust and seek information from myself and reliable sources. Although I will likely continue to experience misinformation with my patients, I will attempt to have a meaningful conversation to provide them with the information for them to make the best choice for their health. Thank you.